This is a really disturbing story. Police in Arizona obtaining DNA from male employees at a nursing home after a woman who has been in a coma for a decade gives birth.
A woman in an incapacitated state gave birth at a healthcare facility in Phoenix last month.
How on earth could a coma patient in a nursing home suddenly get pregnant and give birth? You're going to know all the details today in this video, so stay tuned. Hi, welcome once again to my channel. My name is Anel Griselda. On this channel, I talk about migrating to the UK, opportunities for people to relocate to the UK, and life in the UK as an immigrant in general. This is part of a series called Struck Off, where we share things that health professionals did that nearly put them in trouble, or things that health professionals did that put them in trouble, and then we'll learn a few lessons from these stories, okay? And this is one of the episodes, and I hope you enjoy. For the purpose of this video, let's call our coma patient Elizabeth. Elizabeth was a beautiful young girl born in April 1989. Unfortunately, from when she was 2 months old, she started having very terrible seizures. These seizures got very, very bad that sometimes she would even have breathing problems, during the seizure episodes. So Elizabeth's mom went to see a doctor, and the doctor advised that it was in Elizabeth's best interest to be in a health facility where she could be, taking proper care of instead of being in the house. So at the age of 3, Elizabeth's mom sent Elizabeth to a nursing home. This nursing home was called Hacienda Healthcare. So Elizabeth has been in this nursing home from age 3. So Hacienda Healthcare is in Phoenix, Arizona in the United States. So medically, we can say that Elizabeth was intellectually disabled and was in a vegetative state or in coma the entire time. So they say that Elizabeth was unable to talk, she was unable to eat, she was eating through feeding tubes, and they said she could sometimes express pain through like facial gestures, and she could move her limbs a bit. But then for major positioning, she needs full assistance to be able to position herself. So Elizabeth stayed in the nursing home from 1992, that's when she was 3 years old, until 2018 when the whole incident happened. So at the time, she had been in the nursing home for about 26 years. So on December 29, 2018, one of the staff in the nursing home spotted blood in Elizabeth's clothes. So she rushed to go and check what's happening and then give her a change of dress or whatever. And then she realized that, okay, there's actually a baby coming. Like Elizabeth was in labor and this baby was blue. Okay, obviously because Elizabeth is non-verbal, there's no way she could have called for assistance, and this was a shock because they did not even know she was pregnant. Imagine working in a nursing home. As usual, you see that the resident is bleeding, you're going to see what's happening. Did she get cut somewhere? Did her leg hit somewhere that's making her bleed, or what happened? And then you realize that there's a baby coming out of this resident, and this is a non-verbal resident who has not moved for 29 years, and this person is giving birth. You can imagine the shock. And the sad part is the baby was turning blue. That means the baby had some sort of like respiratory distress. And obviously because it's a nursing home, they do not have the necessary facilities to deliver a baby or to, the aftercare to help the baby or to resuscitate the baby because this baby was in respiratory distress, obviously. So they had to call 911. And from the 911 call, you can see how shocked they were.
Oh, the baby's turning blue! Baby's turning blue!
Okay, where are you at?
We need an RT!
What is the address, ma'am?
Baby's turning blue! Baby's turning blue!
Ma'am, I need an
Hello?
address. I need an address.
I'm sorry.
What's the emergency?
Someone just had a baby. One of our patients just had a baby, and we had no idea she was pregnant.
Okay, is the baby
We were not
out?
prepared for that. Baby's turning blue. We need someone now.
Okay, all right. Go in there with the baby, and I want you to walk this through. Okay.
All right.
I'm gonna wait on the line with you. What's your phone number?
Shoot, I don't know what the phone number is for this. Give me 1 second. I'll find it for you. We have a respiratory over there with them too. The phone number is...
So you can imagine the shock, right? This was really strange, really strange. So because of this, obviously, an investigation was launched and the police started investigating the whole scenario. How on earth could this happen? I'm sure you have so many questions. How on earth did she get pregnant? How on earth was she able to carry the pregnancy full term without anybody, any staff ever noticing when they bath her every day, they feed her every day, they give her medication every day? How on earth was this missed until the day she delivered? Like, how on earth? You're going to know all the answers very, very soon. But may I please say that it took me a while to do this research. Again, reading from several places and then, to put all these things together. I would appreciate it if you could hit the like button. And even more, if you could subscribe and hit the notification, okay, so that you can watch other episodes of Struck Off whenever I release them. So I first came across the FlexiSport E7 desk on YouTube and I immediately fell in love. So I reached out to the company and they sent me this. They sent me this beautiful desk. I decided to go for the bamboo color for the desktop with a black frame. Guys, it comes in 2 boxes and the setup was quite simple. I love this desk because you can regulate the height. It's so cool. And the fact that it actually has a charging port that allows you to charge your devices whilst using the desk is amazing. This is so cool. And it is so durable. I mean, look at that. Look at that. You can order your E7 desks with a link in the description. And they are currently having a sale with up to 33% off. So enjoy. Yes. Tell them that Nell sent you, yeah? Thank you so much, FlexiSport, for sending this over and for sponsoring today's video. So thank God for almighty DNA. So they were able to get the DNA sample of the baby boy and now they had to match it, okay, to get the culprit. Who was responsible for this pregnancy? Now they decided to investigate all former and current male employees of the nursing home. And then they also got the permission to get DNA samples from every male employee of the nursing home. On January 22nd, 2019, they got a match. They got a match, guys, they got a match. And this DNA sample of the baby was matched to one of their nurses, an LPN, a licensed practice nurse, they call it in the US. And this LPN was called Nathan Sunderland. So Nathan Sunderland was a 36-year-old man at the time. They say he was very compassionate, very friendly, very nice. In fact, some of the other relatives of the residents there said Nathan was the last person they suspected. Like they actually had other people in mind. Nathan was the one that they least suspected because he was so nice.
Just to discover today who it was, it's just even more disturbing. He was always clean shaved. His hair was always nicely done. It's completely different than what I see on the picture. I mean, he was always just professional about everything.
Nathan was a Christian. He was a Christian and he was even a gospel musician. Nathan was part of a music group, a duo called Sleepless Soldiers, and they even have one album to their record called A Certified Fake Face. This speaks a lot about you, Nathan. Certified Fake Face, Nathan.
So he's writing raps in jail now with his one good eye.
Yo, what you know about 5? Got a red go to get live. Do we really got goals on my mind? I'm forward.
The sad part is Nathan was married with 4 kids. Some days after Elizabeth gave birth, Nathan was just phoning in sick and cancelling his shifts. When they asked why, he would say that they should just keep on praying for him and that he's going through a lot and that he needs their prayers. So everybody thought it was because of the divorce, because his wife had just filed for divorce some days just prior to Elizabeth giving birth. So everybody thought it was the divorce. They never thought it was because of Elizabeth's delivery. Nathan initially pled not guilty, but I'm sure obviously he knew that the odds were against him. So he later pled guilty. And he apologized to the family. He says that he let his demons take the better half of him, and he was sorry to the family for what he had done.
The pain, the damages, my refusal to forgive my biological mom has done to others through me. I didn't realize I was capable of such evil, disturbing act. To the victim, I'm sorry. You didn't deserve to be hurt. No matter what was going on in my personal life and the demons I was fighting, I had no right to put you through that. No words can express how painfully sorry I am. I am sincerely sorry. And to the victim's family, my deepest apologies as well. To the child, I understand this situation is not fair. and I apologize to you.
So he pled guilty, and the thing is, Nathan passed all his employment checks. Nathan had no prior criminal record, and Nathan was even hoping to become an RN in the future, you know.
Writing his goal was to attend more AZ State Board of Nursing meetings and to continue leadership classes. He also wrote his short-term goal was to get an RN program going, and overall, he wanted to continue to evolve.
The shocking thing is, Nathan has been working there from 2011, so this was strange. We all don't know when he actually started doing this. So he was accused of 1 count of sexual assaults and then 1 count of vulnerable adult abuse, okay? And then they gave him the maximum sentence for that, okay, which was 10 years.
He is 36-year-old Nathan Sunderland. Sunderland is a licensed practical nurse who was responsible for providing care to the victim during this time the sexual assault occurred. Sunderland is being booked as we speak into the Maricopa County Jail, where he will be charged with 1 count of sexual assault and 1 count of vulnerable adult abuse in connection with this crime.
He also registered as a sex offender, okay, and this is going to be on his record for the rest of his life, and he is also going to be on lifelong probation his entire life, even after he's released from prison. So now, how on earth was Elizabeth's pregnancy missed? The staff said that they actually realized that Elizabeth was gaining weight uncontrollably, and they saw that there was sort of like a protrusion on her belly, but they all thought it's a bowel obstruction or it was a tumor. Okay, so because they thought she was gaining weight, they told the doctor and they put Elizabeth on a reduced calorie intake. So they were actually starving the girl and starving the baby because they thought, I'm sure, like, they did not think in their wildest dreams that it would be a pregnancy. Another worrying part is the doctor actually did ask for a scan to be done, but it was never done. And the most shocking thing is, Elizabeth's family visited the nursing home on the 24th of December, just 5 days before she delivered. And the mother noticed that Elizabeth's feet were swollen. So she called the nurse and said, I think Elizabeth's feet are swollen. And then the nurse said, okay, I'll pass it on to the next shift, and then they'll inform the doctor. And she never had any update whatsoever. The next thing she knew, they told her she was a grandma on the film. Yes. And another thing that made the family very, very angry is that sometime back they told them that they suspected that Elizabeth had been sexually abused, and it was a suspected sexually abuse case. So the family said that from that time there should be no male staff attending to Elizabeth, okay? And in the care homes, these things are very common. And if you're watching me and you're a male staff and you work in a nursing home or anywhere, if a patient's file says should be attended by female staff, please respect this, okay? Just respect this. And if for any reason you have to go there, go with a witness, go with somebody else, go and choose, okay? Another thing that shocks everybody is Elizabeth was always menstruating every month. So did they not realize that her menstruation has suddenly stopped for a couple of months? Like, nobody actually realized that this was strange. And as to why the protrusion was on only one side of the belly, a doctor had a better explanation to that.
It could slightly change the direction of the uterus. For example, there was scar tissue more on one side or the other. The uterus may tilt more in that direction.
They thought Elizabeth was just bloated. They just kept giving her loads of laxatives when she actually did not need laxatives.
The court paperwork also lists phenobarbital as a medication the patient was on most of her life to control her seizures.
Phenobarbital is a barbiturate. It is not known to cause any specific birth defects, but it can be very sedating for the baby. As
I speak to you now, the baby is about 5 years old, and they say he calls Elizabeth mommy, he calls the grandmother mommy, he calls almost everybody mommy, and he's a sweet boy. Elizabeth is no more in the facility. As a matter of fact, the facility was shut down. Some of the authorities resigned. It was a big scandal, but it's still in business as we talk now, with residents in it, was reopened again. Later on, some of the staff or the co-workers of Nathan Sunderland were interviewed, and they said that, come to think of it, they now remember that sometimes after they attend to a resident together, Nathan will stay in the room for a bit longer.
So, in your opinion, was he in patients' rooms long enough to where it would be feasible for him to do something like this?
Yeah. Yes.
But nobody actually thought bad about it, and that is another reason why this could happen. And this goes to show a lot of negligence on the part of lots of the care workers. You know, when somebody has been in your care for 26 good years, sometimes I think they overlook things. It took her mom to come and visit her to realize her feet were swollen. So nobody even realized all the pregnancy changes, nothing at all. And another shocking thing is the doctor seems to think that this is not Elizabeth's first pregnancy. They believe that she's actually had babies before or had a baby before. So I asked myself, this is not a known fact, but I asked myself that, is it possible she gave birth in the past, but it was not documented? Elizabeth's family obviously sued the nursing home, and then I think they got about $7.5 million. And I'm also wondering how this little boy is going to feel. Like, your mom was raped in Coma and you were the result of that rape or of that assault. And this is really terrible. As healthcare workers, we need to be very, 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 very careful, I think. So this is how Elizabeth in Coma was able to give birth. This is really strange. This is really, really strange. Let me know, do you think the 10 years was enough for Nathan, or you think he should have been punished more? And do you think we should not allow male staff to attend to females, to curb some of these things? And only God knows the number of times that he's done that. And now the family members of other residents in the home were saying that they need to check their wards, whether male or female, of sexually transmitted diseases, because what if he was doing it to the other vulnerable patients as well, just because they can't talk?
What did you decide to do personally to make sure your daughter who's inside is safe?
I stay here 24/7 now to make sure that she's in a safe environment as well, and just move forward, because trust has been severely broken.
So this is the sad story of Elizabeth, and I hope that we all learn from this. And as a male staff, you zip up and behave. Check out this playlist to watch the other track of episodes. Thank you for watching. Bye.